rules for whether or not we have the appropriate staff on board to meet those program and service requirements. We identify technical assistance, anything that we need from the state. This has been a big one that we've actually had ongoing conversations. One good thing with the pandemic is that, again, we formed a better relationship with our regional director at DHS. And so we do feel like we have better channels for when we do need something from the state, we know who to ask. And then planning for the future or succession planning, this is a big one as well. There's obviously a need to look ahead as we are reviewing what we did in the past. And then preparing for public health accreditation. We are not currently an accredited health department. We do not intend to become accredited in the near future because it is very expensive, but we do want to plan to become accreditation ready. So that means that we would have all of our policies and procedures all documented properly and that everything is standardized across the board. So the review process itself was a pretty lengthy process. It takes about 9 months to get the review up and going. So the first steps are that the Division of Public Health and the Office of Policy and Practice Alignment coordinate a timeline with us. So this started probably about this time last year, maybe a little earlier. And then we started having our internal conversations and actually submitting all the paperwork to, I believe it was DPH directly. And then that includes information about our strategic plan, all of the minutes from our Board of Health meetings, anything else that we would have had to prepare for the state level. So that would be our annual reports, things like that, everything that we would have in place that shows what we've done. And then once they've had time to review that on their end, we met with them in October where they had a half day where they came to our department. We gave them a little tour and then they met with our staff where we went into detail about all of our programs and services and how we are operating. For our department, they're particularly interested because we do have 2 counties that are a little different sometimes. And so they asked a lot of interesting questions about how that functions and what our joint Board of Health meetings look like, etc. And then following our in-person meeting, they take it back to DHS. They decide whether or not our programs and services and the way that we presented them in person match up with everything that we had on paper. And then the state health officer is actually the one that gives us our designation. So in preparation for this discussion, you can see on the board here, these state statutes and administrative codes are what forms the basis of our programs and services that we provide. Some of what we do is left to local control and we can kind of tailor it to what our community desires, but some of it is also definitely led by state statute. So you can see here, communicable disease, maternal child health, environmental health, and chronic disease are some of the basics that we are required to follow up on and things that we are required to have programs for. These are also topics that we typically get grant funding for and don't have to offset a whole lot with our levy. The administrative code underneath is other things that we also have something to do with access for vital records. For example, we do child death review. We would utilize it for things like that. So the in-person discussion, this is where they came in and they met with us. So overall, in the beginning, it was me and the management team sitting in a room with DHS, and they started out talking about our jurisdiction, and that looks very different in Washington and Ozaukee than it does in a lot of the other health departments. So we talked about what the landscape looks like in Washington County, and then we looked at Ozaukee County separately, and then what that means for our department. This is where DHS was actually very pleasantly surprised, I guess not surprised, but happy to hear that we have been working really hard on continuing to merge Washington and Ozaukee as far as our coalitions go and our other community partners over the last several years. The Board of Health is the next thing that we talked about. That is also unique to our department because we are merged. So we have some supervisors from both county boards, and then we also have some citizen members that are on that Board of Health as well. And they were entertained by the fact that we meet in Newburgh, which is exactly in the middle. And we talked a little bit about how our meetings are structured, what the role of the Board of Health is, and then what our reporting is up the chain through Ozaki after that. Surveillance and investigation. This is where we kind of discussed the basics of how we follow up on communicable diseases, how we make sure that our schools are following with the requirements for child immunizations, things like that. Leadership and organizational competencies. This is where we discussed what it looks like for leadership within our department and within the two counties separately. And then what the competencies are of our management team and my position as a director. And then the annual reporting. Obviously, as stated, we went through the annual reports and all the programs and services that we've reported on over the last couple of years. Further discussion topics, this is where we get into the programs and services that we provide. So they actually invited us to allow program managers or other staff who are interested in participating to join the conversation at this point. So this is where I felt it was a great opportunity for some of our other staff to get exposure to DHS and for them to really get to hear from those who are subject matter experts. So for example, communicable disease control, yes, we meet all of the criteria for following up on communicable disease, and I can answer a lot of the questions, but I'm not the expert in everything. I know a little bit about a lot of things. So this is where I had my communicable disease nursing staff come in and they got to shine with talking about their programs. Other disease prevention, this kind of looked like just our immunizations program and what that would be as far as mass clinics, but also what we provide in our department for our WIC clients and those who are uninsured or underinsured. Emergency preparedness. Obviously, this focused very heavily on what our COVID response looked like and what our current needs are based on how that went. Health promotion is our strategy team, which is our community health strategists who actually run our community coalitions. This was something that I'll talk about a little bit later because level 1 health departments are required to do a little bit of health promotion, but to be a level 2 or 3, you actually have to do more engagement with this. So we talked further into detail about it. Human health hazard control is our environmental program. This again is something that's very basic. We have to follow up with human health hazards, but some health departments do more than others. So that also affects whether you're a level 1, 2, or 3. Policy and planning is exactly what it sounds like. Do we have plans in place? Do we follow policies? Do we have written policies? What do they look like? Are they written well? And then our nursing services in general. We have a maternal child health program that is very well intertwined with our WIC department, which is actually very unique. Many health departments across our state have separate WIC and maternal child health programs, and they're not as easily able to hand off those clients who have further needs to their nursing staff. So that was another area where we kind of shine. So this is additional questions for level 2s and 3s. This is where DHS might have some follow-up questions if we are requesting to have a higher level of health department. So foundational areas, communicable disease control, injury prevention, environmental health, maternal child health, all of those basics. We talk a little bit more in depth about what exactly our programs look like, how we serve our clients, what we do for them, and what our staffing looks like. Staffing has been a big one this past year. We did a huge staffing assessment this past, I think it was last August, and we actually found out that according to the DHS staffing assessment, we should, for the current programs and services provide, we should be like 70 something employees higher than what we are, which is of course absolutely ridiculous, but it showed that we are providing some really good services. Workforce development, that includes core competencies, performance evaluations, and personal development. This is another area where a lot of health departments apparently struggle, but because we are part of a county operation, we already have that kind of set up for us at the county level. So we were able to talk about that pretty easily with our performance evaluations. We do all of that on a regular basis. Performance management. that would be our staff training, any barriers to performance management that we could come up with. That was our opportunity to talk about that. That's something that we also do kind of at a county level through Ozaukee County. So we talked about what that looks like, how we track our performance, how we analyze it, is it measurable? The next one is community health strategists. This is where our public health strategists do data collection for our community health improvement plan. We do community health assessments. We run our coalitions. And we are supposed to be considered the experts within our jurisdiction. If we are considered really to be involved with our jurisdiction, this is how one of the things that can get us to be a level 3 department. So they were actually very impressed by the way that our strategy team has continued to form those relationships between the two counties and get other partners engaged in the work that we're doing to make sure that Washington and Ozaukee counties are safe and healthy. Environmental health program, participation and provision of expertise and development of community plans. This is another one where we are required to do the bare minimum. Like I said earlier, human health hazards is one where we're required to respond. But we can go much further than that. So there's other programs that are run by the state, such as food and recreational licensing, lodging licensing, hotels, community pools. We do all of that, whereas some jurisdictions actually leave it up to the state level. So we have more control over what our restaurants are looking like, how our pools operate, how all of our recreational camps are operating. We license all of those. So we got to talk in pretty great detail about that program. And then that also rolls into our well water testing. For those of you who don't know, we do test the well water for all of our public wells in both counties. And then we also cover Milwaukee County as well. So that's a really big program and it's much more robust than a lot of other health departments. So they were pretty impressed by that and we spent a lot of time talking about it. The state public health agenda is basically they listen to us talk for a while and then they decide, we don't really talk about this in the meeting, but they decide whether or not we are in alignment with what the state health improvement plan looks like. So typically we would be following what their goals are and to some degree following that and providing the programs and services that state statute is requiring of us. But we know as Washington and Ozaukee County, sometimes it looks a little different for us. So we do tailor to the needs of our community. Of course, we have that local control, which is a nice way to kind of steer our own ship. And then quality improvement. This is where we discuss goal evaluation and progress reporting across the board for all of our programs and services. This is a really hard one to quantify and really explain for every single program area. We got to the end of the conversation, they were like, well, how do you measure that? Like, how do you know what success looks like for each of these programs? And that's something that because we came out of COVID not too long ago, we had stopped providing some of our programs and services for several years. And so we are still in kind of that phase where we just recently started them all back up and therefore have not been able to really successfully measure some of the success of those programs. We're still working on it. It's a work in progress. So you will see towards the end of this presentation in a couple minutes, a little bit of one of our goals for the future is to be focusing more on quality improvement. So that's kind of the basis of like what this review looked like. This is every 5 years, they talk about what it looks like, what public health looks like in our jurisdiction, how we are providing these programs and services. And then we get our feedback from the state. It's our opportunity to tell them exactly what we are looking for from them, if there's anything we need from them. So we talked a little bit about some of our needs from the state level, and then we wait a little while and they give us a report at the end. It's not a finalized report. It's really a breakdown of all of their questions they asked, the answers we gave them, and then any feedback they had for us. So some of the highlights of this report for this past year, which came to us just a couple months ago, were that we have a really, as I stated earlier, really robust environmental health program. They're very impressed by it. They actually asked numerous times if we have the support that we need to continue it. As of right now, I feel like our staffing is pretty adequate and we do keep up with it, but they're busy. It's a good busy, but it's it's actually one of my favorite programs because they do all kinds of different things. And a lot of people don't really think about who licenses their restaurants and who's checking their well water, all of that. And then another one that they were really impressed by our department, again, was our public health strategy staff and some of the coalition building that we've done. For those of you who don't know a whole lot about our coalitions, we, up until last year, I believe, we're running separate coalitions for mental health and substance use in both of our counties, and our strategy teams were doing double duty, running one here, running one there, separate meetings for the same things. And then some of our community partners were having to attend multiple meetings for the same subjects, and it was just a lot of redundancy. And we had 2 community health improvement plans, one for Washington County, one for Ozaukee County. And when we did our last health assessment, we realized that although things look a little different when you get to the ground level on how we operate and how we attack those issues, the main issues of mental health, substance use, and sexual health and wellness were our top priority areas in both counties. So we merged our community health improvement plan into one community health improvement plan for our whole community. And then after that, we kind of coaxed our coalitions into merging as well. And we've been kind of helping them continue to merge all of their efforts thus far. So that was something that we talked about in great depth with DHS because they knew it was a huge undertaking, and that was something that they were particularly impressed by. As far as opportunities for improvement go, this is something that they mentioned. We do well, but there's always areas for opportunities for improvement, right? So one of them, again, was quality improvement, making sure that we are really finding ways of measuring the programs and services we provide, being able to speak to them, whether or not we need to change them, how are we continuing to improve everything that we do. And then another one was more intentional focus on health equity, which has been very difficult in our communities. I personally believe that that's something you can do whether you use the words health equity or not. We do incorporate it into all of our work. We are trying to constantly provide programs and services that the public needs here in Washington and Ozaukee in the ways that they need them. But that is an area where DHS would like to see more from us. So we talked a little bit about what that might mean, and then we take this to the drawing board internally to decide how we are going to tackle that for the next 5 years before our next 5-year review. Then the final step is the level 3 designation that comes from Paula Tran. She's our state health officer. That was where we finally got a reward at our May of 2024 Board of Health meeting. So a couple of you were there for that. This is where I had actually our regional, Southeastern Regional Director from DHS. He came and presented the award to us and talked a little bit to the Board of Health about what it means to be a level 3 health department, the programs and services that are required to do that, and then said some nice things about our staff, which is always good to hear as well. But that's kind of the end of my presentation. I do have, the ability to answer questions if you have any further questions about any of that, but I'm hoping this gives you a little bit better idea of how we operate, why we operate, and some of the programs that we are required to do by state statute and how that oversight happens with DHS.
Thank you.
Yep.
That was an excellent presentation. You did mention well water testing, and there's been a lot of attention to PFAS lately. I know West Bend has one well shut down because of it, and they're doing remedial action. Is that one of the things you test for?
Yes, municipal wells. So we don't do residential well water testing. We will work with municipalities on their well water, and we try to do everything we can with them for remediation prior to having to dig a new well, because that's always obviously the most expensive option. But yes, that is something that we focus on with our environmental program.
Do we have other communities that have wells in similar shape, or aren't you at liberty to say?
I think it's a little bit more of a known issue in that area, but it's across the board. Yeah.
Thank you.
Mm-hmm.
Any other questions? Supervisor Shodman.
Thank you, Chairman. Real quick, just as a measure, how do we compare to like Dodge County, like we were talking about level 1, 2, and 3? How do we compare to Dodge County, Sheboygan, Fond du Lac, our neighboring counties with that level?
Compare it in regards to what exactly?
Are they at the same level? Are they at 3 or 2, or do you know where they're at?
Dodge County, I'm not sure exactly. I know Waukesha is a level 3. Some of the bigger ones typically are, but not always. Sometimes they choose actually to level down to a level 2 because some of the requirements are actually regarding hiring of a health officer, which has been a struggle in the last few years. So there are a couple of them that just decided, we can do what we're doing and still be a level 2. And so they've actually dropped down in the last couple of years. But I'm not exactly sure which one Dodge is right now.
Okay, thank you. I was just curious how we compare to other counties. Thanks.
I know that there are 34, I believe, level 3s in level 3 health departments in the state.
Thank you.
Supervisor Gallantz.
Thank you, Chair. Earlier you had mentioned about accreditation, and I think you said this, so you may have answered my question already. Is the desire to pursue preparation for accreditation primarily for process improvement, quality assurance in-house, so we can evaluate ourselves versus getting the accreditation, which could mean other things and have other consequences
That is
and
actually,
or requirements?
yes, that is our desire at this moment, which actually brings up something that I forgot to tell you. So as of last week, we did take a new position request to the board in Ozaukee County for a quality improvement and communications manager. And that position is my answer to the quality improvement request. I would like to see more quality improvement attempts in our county or counties in our department, but I want that ownership over it. So that person is going to be in charge of making sure that quality improvement and all of our compliance and everything is kind of up to par with what it should look like, kind of according to the FAB accreditation rules, but we don't plan to actually ask for accreditation at this point because we don't necessarily need that extra oversight over it. That makes sense.
Yeah, it does. So we want to measure ourselves against a standard,
Yes,
but not necessarily seek that
correct.
accreditation because of everything that comes with it.
Yeah, as of right now, there are health departments that are accredited. They've had at some point some sort of funding that they had that gave them the opportunity to do that. But many of us feel right now that the price for it kind of offsets the reward. There isn't a whole lot of reward for being accredited other than bragging rights at this point. If there was more of a reward for it, we would maybe push for it, but there's just, it's really just another set of oversight and further review processes with the state that we don't really need. We can work on quality improvement within our own department.
Thank you. You had also mentioned about, I believe the DHS participated in what was it, a staffing assessment? You said last fall. And you made a comment about there should be more FTEs. So where do you think that's coming from? And I guess what I mean is, I think that you said under improvement that they recommended maybe some focus on health equity. Well, is that Madison saying we need to be doing this? We've had this conversation a few months ago. What's good for Washington County and what are we doing versus what's good for Madison and pushing down 2 counties, which we may believe, we may feel is not right for Washington County.
Right.
So I'd be curious to understand how much of those 2 influences, one, focus on health equity. Is that just to meet some bureaucrat in Madison's view, or is it to really truly serve our citizens?
It's really to truly serve our citizens, but with that said, our citizens have a different need than citizens across the rest of the state. So what will be needed here is not what's needed in Madison or what's needed in Milwaukee. It depends on your definition of health equity, but to us, health equity means that we are serving the public in Washington and Ozaukee counties to provide the services that they need to ensure that they have their health, they have theirs, anything that they need to make sure that they're healthy. So sometimes for us, that looks like small things like we have been recently working with the Autism Society and making sure that we have a sensory friendly place to go for our WIC clients and their children when they come into our WIC clinics. It also looks like partnering with places like Casa Guadalupe for what we know is a pretty high Hispanic population in Washington County. In Ozaukee County, a little bit more than Washington County, we have a migrant population that we work with. We make sure that they have the medical needs met with them because a lot of times they are either undocumented, they're underinsured, uninsured, homebound clients, that sort of thing. That's what health equity looks like to us. We're providing the services to those who need the extra help to get the health needs met in Washington and Ozaukee. So I don't know if that answers your question, but it does look a little different here.
Yeah, it does, thank you, because what might be good for one isn't necessarily good for all. Thank you.
Any other questions or discussion? Supervisor Conrad.
Yeah, I just want to thank you and for sustaining the department and everything during these crazy COVID years. You know, a lot of other health departments across the country, and it was out there in the news and everything too, truly struggled, I think, a lot more than Ozaukee and Washington County. So I just want to thank you and for sticking in there too through all that, because a lot of people in your positions too left. So please let us know too what we all can do to help sustain your progress. Thank you.
Well, thank you very much for taking time out of your evening. I know Ozaukee County meets in the morning, so thank you very much.
Great, thank you all.
Thank you.
Thank you.
Our next item is resolution 15, the commendation of Nancy Bendis. Welcome in a second, please. Supervisor Hartley, Supervisor Toma.
Whereas Nancy Bendis has contributed 20 years of loyal service to the citizens of Washington County, and whereas Nancy Bendis has chosen to retire from her present position of benefit specialist with the Aging and Disability Resource Center, now therefore be it resolved that the Washington County Board of Supervisors pause in its deliberations to pay tribute and to commend Nancy Bendis for her 20 years of meritorious service. Be it further resolved that on behalf of all citizens of Washington County, this body does herewith extend to her heartfelt thanks for her many accomplishments and successes. Be it further resolved that a copy of this resolution be forwarded to Nancy Bendis as a token of appreciation on the part of this board.
Next up is resolution 16, which is a general funds transfer to support the Washington County Agricultural Industrial Society for Fair Park initiatives. May I have a motion in a second? Supervisor Bossert, Supervisor Kelly. Discussion? There being none, we'll vote electronically. This is a 2/3 vote. It passes unanimously. Next up is resolution 17, which is a grant application for Paul Covergall Forensic Science Improvement Program for Bureau of Justice fiscal year 2024. A motion by Supervisor Shadron, second by Supervisor Schwab. Any discussion? This was covered real well in the Public Safety Committee and passed unanimously. So we'll vote electronically. This is also a 2/3 vote.
Unanimous.
Also passes unanimously. Next up is resolution 18, authorizing Washington County to enter into the settlement agreement with the Kroger Company and agree to the terms of addendum 2 of the memorandum of understanding allocating settlement proceeds. A motion and a second, please. Supervisor Schultheis, Supervisor Troutman. You want to speak? Any questions? This is just another in the long line of opioid settlements. Supervisor Vispalik.
Just because there's so much language in there and I'm not an attorney, and can we just, a little bit, maybe simplifying it, just a little clarification on this, I think would help me. That's just like I said, it's 5 pages and just to understand it a little bit more would help. Thank you.
I'll turn to our attorney.
The resolution is a boilerplate. We've been asked to approve it as is by council represents us in the opioid litigation, which we've been involved in since 2017. It mirrors other resolutions we passed in, I think, 2021, 2023. Essentially, what it does is it authorizes the county to take part in settlement proceeds. It also indicates that the attorneys who are representing us will partake in a portion of those proceeds, and that certain amounts of that money will be set aside. There's still ongoing court action. None of this has been resolved yet. This is just an opportunity for us to participate in the settlement once it's reached. It's supposed to be about $1.2 billion once it's done. We're hoping that we start seeing some of that money this year. However, the amount of money Washington County is due to get, we don't really know yet. They're very early on in negotiations. So this is an opportunity for us just to be able to participate. The reason it's coming to the board tonight and had not gone through committee is because this has to be approved before, I believe, August, well, maybe first week of August, I think it is, and we don't meet again before that. So this is basically just to get the ball rolling. There'll be other documents, other agreements the county has to sign, won't be coming back before the board, but this is so that we can partake in that process.
Thank you for clarifying.
You're welcome. Supervisor Krieger comes up.
I just wanted to know, is the $1.2 billion just Wisconsin, or is that throughout the United States for those people, for those government entities that sue?
I believe it's throughout the nation.
So it's not a lot of money.
I don't know what it's going to be for us yet.
Yeah, okay.
Any further discussion? There being none, we'll vote electronically. This is a simple majority vote.
Unanimous.
It passes unanimously. Our last item is resolution 19, which is a resolution confirming the Washington County Community Development Department providing municipal planning services to the village of Richfield as part of shared revenue of the county sales tax. Motion and a second, please. Supervisor Conrath, Supervisor Pridemore. Any discussion? This is very similar to a couple we've seen in the last few months. There being no discussion, we'll vote electronically.
Unanimous.
It passes unanimously. Our next meeting date is Wednesday, August 14th, 2024. This meeting's adjourned.